manufacture a new shuttle to the moon. And he says, yes, if you will go. That provides insurance for every Vermont resident with a common benefit package. That's part one. Second part is channel all the payments to the provider through a single pipe. So you say, when is fiscal? Do you have the money to do what you want to do? Who is willing to pay for it? What are the legal barriers, including Medicare law, Medicaid law, the PPACA, and ERISA, the elephant in the room. And then also, the representatives and senators here, you represent different constituents. Each one is looking after their own interests or their own beliefs. What's possible on the political landscape? And last but not least is, if you want to make something work, you need to understand how to operationalize it. You can have everything to the major 6 parameters from which guided us in our design. First is we will lock in and maximize the federal funds that will flow into Vermont. We do not want to do anything to jeopardize that. Second, there's no overall increase in health spending because in our stakeholder analysis, we've heard from every group, business, labor unions, grassroots, public, they all say, we are spending enough for health care. It's taking away our spending for education, for environment, for creating jobs, or just to enjoy other parts of living. We do not want to spend any more overall for health care. We will not and do not recommend a change in the Medicare program and the benefits that Medicare beneficiaries receive. Because if that change that would require the act of Congress, but that also could make the elderly and disabled people feel, gee, what are you taking away from us? So we want to assure the elderly and the permanently disabled people we will not disturb their benefits. But we would unify the payments paid out in the Medicare into one single pot. Another savings you can do is tort reform. And that's why I have many friends who refuse to return my calls, and these friends are tribal. In other words, it's a point estimate. For the margin of error could be plus minus 15%. And some of these numbers, the margin of error could be 20%. So do not treat this as something certain, because we have to make many assumptions. Other countries found the best way to do it is you create an independent board. The people who have to pay, that's the employers, workers, and the government. They sit on one side of the table. The people who receive the benefits and payments sit on the other side of the table. That's the hospital representative, physician representative, representative of other health professionals, pharmaceutical industry, and people who advocate higher benefits for them. They sit on the other side. They negotiate. You want more? How much does family have? how much more do I have to pay? They come to agreement, make a recommendation to the state legislature and the government. In other countries, they found that the most effective way to control costs. If let the government run, government is a monopoly. We know from businesses a monopoly what they will do. You will exploit the consumers as well as you get lazy. When you are a monopoly, you do not have to innovate because nobody is competing with you. You can do things the way you always have done. And you have power. They have nowhere else to go. But even for the Vermont-based insurance organizations like your Blue Cross Blue Shield, under single payer, you do not need sales and marketing people. You do not need underwriters. These people will lose their jobs. And the physician officers, whose job is mostly to handle the claim, to decipher what benefits payable by which insurance company, how much do you have to charge the patient on the spot, whether the patient is insured or not insured. These people are going to lose their job. It is a small employer, employ less than 10 people. Many of these employers pay very low wages. They will be exempt from this payroll contribution. But those who pay higher wages, now they have to pay more. Since this is a payroll-based contribution, if they are good, high-earner family, I think that probably most of the people in this room, you and your spouse both work, earn, your employer gives you health insurance. And you probably say, all right, we're only going to have insured by one employer. The other one will not be signed up for insurance. But under single payer, both of them have to pay the payroll contribution. They will